and welcome to Back to the Future, a Pheo pop culture retrospective. We're very happy to kick off Pheo Awareness Week. My name is Chad Riding, and I am a Pheo patient. Joining us, we have Dr. Tanaz Vaghaiwalla from the University of Tennessee Medical Center. Dr. Vaghaiwalla, could you introduce yourself?
Well, hi, everyone. I'm very excited to be here. As Chad says, I'm Tanaz Vaghaiwalla, and I am an endocrine surgeon and the director of endocrine surgery at the University of Tennessee. And I take care of a great many patients with pheochromocytoma and paraganglioma. I'm very happy to be here and be a part of Pheo Awareness Week.
Great, and we're really happy to have you and your experience in this area of Pheo surgery and endocrine surgery, and just to learn how you can add some insight from your practice and knowledge about what went right, what went wrong, and these various depictions of Pheo as a rare disease, it's not very common to see this in any kinds of pop culture. A little bit more about myself. I had a Pheo diagnosed in June 2021. Actually, I thought it was a but it turned out to be a Pheo. So I went on blockades in July, had my Pheo removed on my left adrenal. It was a 6.1 centimeter Pheo. It was removed August 31st, 2021. So far, so good. I've been clear on my scans and my blood work. So just, maintaining my yearly blood work and as it goes forward. So wanted to talk about some really important things that we have in this area. So one is just really patient knowledge about this and getting the right information out there. And one thing is a Quincy Medical Examiner episode from 1980. So the episode is called The Hope of Elkwood, and it's from season 6, episode 4. And so Dr. Quincy is on the stand, and he's actually giving out very clear textbook information about Pheo. And it was really interesting to see that that was actually a very concise, clear explanation of Pheo. And I was wondering, Dr. Vaghaiwalla, from your experience, how common is it to get these kinds of clear explanations in the media, news, things like that?
I would say not very common. I was pleasantly surprised to see how much detail was presented in this video clip. And fairly accurate, but I would say many times the media gets it wrong or is working off of old information, which is why events like Pheo Awareness Week are so important. But this clip in particular had a lot of detailed information, and I was very happy to see that, even though it's really quite an old episode.
Yeah, and what's interesting too, as you said, is it's so old, but they were able to get it very concisely. In your opinion, what is the state of Pheo awareness, and has it really changed a lot over your career?
In my career, I am lucky because I'm always surrounded by research and education and awareness as an adrenal surgeon within endocrine surgery. But of course, most patients and providers in the community may not be encountering this disease with such frequency. And so we do see patients with quite a lot of delay in diagnosis, as we'll discuss further on throughout this, our talk, that many times the patients are misdiagnosed or undergo several different alternative types of treatment, which are not the correct treatment for Pheo. And that has a lot to do with the lack of information and awareness out there.
And I know for my case, I was misdiagnosed with a couple different things, and it took years to get the Pheo diagnosis, and it really only came because I had a hypertensive crisis during a surgery, and almost passed away. It was very, very.
That is the wrong time. That is the absolute
wrong.
worst time for a Pheo to be diagnosed. We want to catch it way before then.
Yeah, it was a pretty scary sight, and waking up what you thought was going to be an outpatient surgery in the intensive care unit intubated was a little bit of a surprise. But moving on to kind of along those lines is we have MASH. It's season 10, episode 20, Sons and Bowlers. So there's two main plots. One is a bowling tournament, obviously not Pheo Para related, but then about one of the main characters, Hawkeye Pierce, he's played by Alan Alda. He's a doctor in the Korean War in the early 1950s, so it kind of sets the time frame as what this would have been like in Pheo Para awareness. Though this episode is from I believe 1981, 1982, somewhere around there. So he gets a letter from his father that took several weeks, that he's going into surgery the next day in a small town of Crabapple Cove, Maine. So Hawkeye's frantically calling around and asks for the hospital. He finds out that they're doing surgery to find a mass on his kidney and that they want to remove it. And so they find out through the surgery that it's a pheochromocytoma. So they remove the Pheo and all is well with his father. So that's kind of the overviewing plot of the episode for this Pheo. What's interesting, and which I thought is one of the lessons, and I think was great that pop culture really emphasized this, is how critical it is to have a support network. So, as a surgeon, he has other surgeon colleagues, he has nurses, he also has enemies amongst those doctors, which is interesting. So his foil and of a lot of his tricks and pranks is Dr. Major Winchester, Charles Winchester, who's from the Boston Upper Crust, who's not liked at all. But yet when he finds out that Hawkeye Pierce's father is going through this, and the mental trauma that Hawkeye Pierce goes through, that he's able to offer his support and help, and just how much strength emotionally that gave to Hawkeye Pierce, I thought was a really interesting lesson. So Dr. Vaghaiwalla, I'm curious, over your career, just in very general terms, how important has it been to have those kinds of peer and family, friend network support?
Oh, absolutely. I mean, I think it is vital. We know that a multidisciplinary team in the care of patients with Pheo, Para, and really most diseases produce better outcomes for our patients. And that's what matters the most. And so as a surgeon, I am always looking to who is on my team when I'm taking care of patients. And, as you know firsthand, the relationship between the surgeon and the anesthesiologist in the room is vital to the outcomes for our patients with Pheo and Para. Certainly, when surgeons encounter challenging cases, it's very important to speak with colleagues, speak with other specialists who might be more familiar in that area, so that way you can come up with a plan that best serves the patient. So the network or the team is absolutely vital for the patient. And I would imagine on the patient side, having that support network, meaning, really getting to know your surgeon and how experienced they are, your anesthesiologist who's going to be taking care of you that day, as well as having friends and family or a patient support group like Pheo Para in anticipation of your procedure or ahead of your care, I think can make all of the difference.
Yeah, and that's so critical, is the communication between the anesthesiologist, who keeps you alive during the surgery to many extents, and then the chief surgeon who's removing it, is so critical in having the supportive nurses and healthcare professionals. I know in my case, as I was preparing for surgery, and also, the time before, is trying to get a good diagnosis, having family and friends that were supportive. They understood that you were going to, willing to take you to, back and forth to some of your appointments. I know for me that it is a really scary time, particularly when they said that I had a mass either on my pancreas or my kidney. They did an ultrasound of my bladder, found a mass on my pancreas or kidney. And they're like, this is serious. We need to get you a CT scan. And then they're like, we don't know what it is. And just having that support from friends, talking to friends, and it's really hard. And so what happened in the episode too is that it was Major Winchester that approached. He heard it, kind of eavesdropped a little bit, but heard it, and then he approached him. And so I thought that was really touching, and it also sometimes really showed the importance of taking that first step. And once I started to tell people, it was kind of awkward, but like it got a lot easier as the more people I told and the more people I kind of discussed these issues. And one thing too, going throughout the patient support process is just this, and I'd like to, plug pheopera.org, is, contacting people who had gone through the surgery. Tell me what I should expect, knowing that this is something you need to follow up on in your lifetime, having those kinds of expectations. I know that this is a really supportive community, and I was glad that I was able to find it.
I absolutely agree. I wish there were more organizations out there for patients with other diseases like pheopera, because, as doctors, we want to explain things the best way that we can, but, there is certainly a barrier if we haven't been through it. A lot of times the language that we use, maybe we're not the best communicators. And so if a patient can speak with someone who's already been through it, what was hard for them or what was easier for them, I think that helps that patient at least reduce some of that anxiety, because not knowing is, I feel, oftentimes the worst thing.
Yeah, and that's so true, is having the doctors to sit down and speak with you. And then Pheopera was able to take time a little bit more, because doctors are so rushed. They have so many patients they need to see. I felt that I had a really good team, but even it was nicer to have this on top of that, to be able to discuss.
Of course, we don't ever want you to feel rushed, but I can certainly recognize how, there just may be so many questions, and as things arise, if you have that support group of someone who's actually been through it, I think that's just so valuable.
Yeah, and people are also kind of intimidated a little bit by surgeons, in that surgeons are very highly respected people, and so you don't want to ask them what you think is like a dumb question, even though there are very few dumb questions.
No, there are no dumb questions.
So one thing I did mention, or did see in the episode, is they didn't mention blockades or anything like that, which I thought was very interesting. Is that pop culture likes to portray things as one and done, and this is something that you see kind of throughout the episodes we're discussing, is that they have their Pheo removed and it's over. They don't show 6 weeks of blockades, monitoring your blood pressure 4 times a day, the unsexy part of being a pheopera patient that wouldn't make good for good television at all.
Well, certainly, I think we know that there's the surgery is just one aspect of the care for pheopera. Equally important is the preparation, whether it's preparation for surgery, that preparation that the anesthesiologist does prior to the patient arriving. There's certain medications that really should be ready, certain blood work that should be checked beforehand. All of that takes time. And then, of course, the surgeon who's working closely with the endocrinologist, or it may be another specialist who's preparing the patient in terms of their blood pressure at a time, that can take several weeks to months. And there may not be time to go into all of that detail in a 20 to 30 minute episode, but equally important to the surgical component of the care.
Yeah, it's all kind of a long process with several different players, I know I went to the hospital, oh gosh, it must have been every week for like 2 months. maybe multiple times a week, actually. And, it's just, it doesn't make, as you said, for good television, but it's so critical that people, in the patient community understand this as like a reasonable expectation. So I wanted to move to our next episode, and it's The Good Doctor, and it's season 4, episode 11, We're All Crazy Sometimes. So there's a B plot about, a car getting towed. There's another patient with a spinal condition. But, one thing that they hit upon, which is the Pheo connection, is a woman is in a coma for 10 years, and her husband's having issues removing her from life support. The doctors find a spinal paraganglioma, and they remove it from the woman. So no discussion of blockades or anything like that, or hormone levels before this. But right after the surgery, she wakes up as they're removing the life support. So she, after this 10 years of coma, suddenly is lucid and seems to be healthy, but they determine that there's a dopamine rush from the paraganglioma removal that triggered her to awaken from this coma. But they determined that it would wear off quickly within about 24 hours, and that any further dopamine provisions would probably pose a significant health risk. And they do remove her from the life support. So it was a very sad episode, dealing with loss and death and acceptance. But, in terms of how was it portrayed as a paraganglioma, is that, some of the lessons I got is they were really interested, determined to investigate what was wrong. And, I found through my experience that, I had the hypertensive crisis during surgery. They didn't know what was right. They gave me drugs to lower my blood pressure. They tested me for drugs if that was causing it. Obviously nothing. And so, they weren't able to determine what it was. They thought it was some kind of fluke. But, because my urologist was interested in finding out what that growth was, I had follow-ups. I had the urine test. And, they really wanted to find out what was wrong with me. And having that multidisciplinary team was really good because, they were actually going to do a biopsy. So they're going to put me under, do a endoscopy, and then take a biopsy. But the day before they were going to do that, the anesthesiologist called me and said, nope, we're canceling it. We think it's Pheo. That would be very dangerous and could lead to another hypertensive crisis. And so that then led to my diagnosis. And so for me, I was like, oh yeah, a multidisciplinary team really trying to get to the bottom of it is so critical in Pheo care. And I liked how they showed that. I don't know, what did you think of this episode, Dr. Vaghaiwalla?
Well, there are certainly many, many themes that really, hit a nerve here. Some of them are a little beyond the scope of Pheo in terms of, what's going on with this patient. We always worry about release of catecholamines during stressful times, during surgeries, and during biopsies. I'm actually so glad that you mentioned that, because I would say the other time that we, don't want to have a surprise diagnosis of a Pheo would be during the biopsy. And so actually, radiology, their guidelines very clearly state that if a biopsy is to be performed on an adrenal nodule, to make sure that you consider a Pheo or a Pheo prior to that biopsy. And, some blood work can be very, very helpful and a very non-invasive way to make and standard of care the way to make the diagnosis rather than the biopsy. And so I'm glad you had such a anesthesiologist who was so dedicated and told you beforehand and really wanted to investigate what's going on rather than have a procedure done, and oh gosh, could have just been a terrible, terrible outcome there. I think there's some dramatic aspect to the TV program. I don't know if that could actually happen in real life, where someone could have such a dramatic experience, but certainly that rush of catecholamines can cause a person in many settings to feel symptoms of anxiety, severe headaches, palpitations. One of the classic scenarios is, a patient may feel like they're having a panic attack or a heart attack because they are having these symptoms. And then during that workup, a Pheo or a para is identified. But certainly some creative licensing in terms of the creation of TV shows.
Yeah, it was really interesting when they were going through that episode, is that, yeah, they didn't need to blockade this person, and they didn't, go through a lot of the steps, but it's so critical that, they dot their T's, cross their I's, and that, they're just interdisciplinary team. It would have been nice to see, of course, this would have confused things from a pop culture perspective and being in the writing room, but like maybe having like an endocrinologist on the team, or piping in and maybe explaining it a little better, might have given a little bit more insight into the disease. I thought that was really interesting. One thing too that they talked about, they have the surgery, it's successful, and then they go and they show the lab write-up, and it's like, you're cancer-free, it's not metastatic. And I mean, that takes weeks. We know with this disease that you can scan somebody, you can do the blood work, those hormone levels can be normal and, not indicative of any kind of metastasis, but like it's lifelong, follow-up for this person as per the guidelines. And so it's really interesting is that, pop culture likes to seek these easy answers, but with Pheo, there really aren't any definitive answers, for as to whether or not you'll be metastatic or not. And it's really hard to portray that, and you can't like confuse people by kind of losing the plot, but it would be nice to show that a little bit more.
A little bit more detail. I agree with you.
Mm-hmm. Absolutely. So we're moving on. We've talked about, for the Good Doctor episode, on some of it was a little dramatic, of one waking up from a coma after several years. There's a House episode. It's season 2. It's a season opener called Acceptance. And it's about an inmate named Clarence who's at Mercer State Prison, who's killed several people and is on death row. And so he's brought into the hospital with an irregular heartbeat and abnormal hormone levels. He's showing extreme aggression. So they check his hormone levels and an MRI. They have an MRI, and they determine that he has a pheochromocytoma. So they remove the pheochromocytoma, and then he goes back to prison to death row. And then the doctors, knowing that pheochromocytomas have an impact on adrenaline levels and other hormone levels, that they want to testify on his behalf to get, clemency. There was a lot there. And in that, and I really liked how they showed in this episode that it was a process of misdiagnosis. They were searching for the diagnosis, they couldn't find it, and then finally they came up with this pheochromocytoma. And of course, as we've discussed, a running theme throughout is that they don't talk about blockading, they don't wait, the 6 weeks, look at the hormone levels. As you go throughout that process, they don't talk about also, about how alpha blockers and beta blockers, you just feel so exhausted on them. And it's climbing my stairs in my home is just, when I was on them, they were just so tiring and so difficult. But in any case, they talk a lot about the mental health impacts and the well-being impacts of being on Pheo pairs. And so, what are some of the signs, doctor, about that people can have while they have Pheo pairs?
I would say, it can vary quite a bit. I mean, certainly fatigue can be a big one, like you said, and then just undergoing the routine management of Pheo is very intensive in terms of scaling up medications, frequent doctor's visits, a lot of the anxiety that just comes with, being a patient and going through this process. In terms of the Pheo itself and the catecholamine release, well, we certainly know that having adrenaline in your system, it triggers that fight or flight response. And so patients can have many of the symptoms that I referred to, such as feeling palpitations, such as they feel like their heart is racing. They may have headaches because their blood pressure is really high at the time of release of that adrenaline. Many times they can have diaphoresis or sweating. And so, certainly many uncomfortable symptoms. Patients may feel like they're having a stroke or a heart attack. And so they may rush to the ER. There's a certain amount of course, anxiety that can come with all of that. But I would say patient to patient, the symptoms can vary very widely. And the hormone release can be episodic, meaning it's not constant. It may happen at different times, maybe during stressful times. And so that can also hinder the ability to make the diagnosis.
And I know and I just like to say from my perspective, like being in the patient community, hearing other people's stories, some people do really have those instances of mood swings. I didn't have mood swings that I can recall per se. Definitely having what I guess was a panic attack, but like I know there was, because my catecholamine levels were 20 to 30 times normal, which is I think fairly common amongst pheochromocytoma and paraganglioma patients. But I know like when I had my pheopara, I was a lot more anxious. I did overthink things a lot more. And then I noticed just a few weeks after, maybe it was like a month or two after, like when the hormone levels started to, the adrenaline started to go down, I noticed that I stopped worrying about a lot of things. I felt a lot better in terms of mental health. And I know today, like not having had that huge amount of adrenaline in me for so long, like I do feel a lot calmer. I have far fewer instances of anxiety. It's just mentally, it is so nice not to have that. And just the physical symptoms too, like they misdiagnosed me as having acid reflux. That's actually the type of surgery I had, that I had the hypertensive crisis, is because I was having those palpitations, lots of nausea, upset on my stomach, where I would feel almost every day for weeks, months, just sick on my stomach. And the the acid reflux heartburn medication didn't really work anymore. And the headaches that would come on, and it would just be like all of a sudden, like I wasn't even like I was sitting in a train commuting home from work, and all of a sudden I'd have like this attack where I'd have like, pain in my chest, headache, and it was intense. And I didn't know what was wrong with me. And I thought everybody's like, oh, you just have heartburn. You just need to, stop eating stuff. And I cut out everything from my diet. And I mean, I don't know. I mean, I can't say everybody's experience. And obviously we don't want to say, that Pheo and para are necessarily excuses for what this person did. But it was interesting that the doctors in the pop culture experience wanted to at least testify that perhaps there were some mitigating circumstances. I don't want to get into that whole issue, but
Yeah, no.
yeah, but it was just
No,
interesting
I
is
would
that,
agree with you.
yeah, it was just,
Go
please,
ahead, go ahead.
I was just going to say, it was just really interesting to see, like, they at least talked about those mental health impacts, even though it goes into some areas
Yeah.
that are very complicated. It was very good that they showed that there are mental health impacts from pheoparas.
I did yes, that aspect I think is very, very important because it just goes back to our point about how these tumors can get misdiagnosed. You know, again, certainly, you know, in the creation of a TV show, you know, Pheo can be a very dramatic topic and you know, for programming. But in terms of patient symptoms, you know, whether they're related to the new diagnosis or whether they are related to the disease, I do think, you know, the value of having an organization like Pheo, or having that network that we talked about, can really help patients probably tease out a little bit of, you know, what to expect, you know, once that diagnosis is made. Of course, you know, for me, when patients have these symptoms and they're coming to my office, a lot of times the diagnosis has already been made. So I certainly have a bias there. I'm always thinking about Pheo, or if, you know, friends or family are talking to me about certain symptoms, I'm always thinking of Pheo, because that's my specialty, that's my area. But it can be very, very challenging in the community where you're seeing a wide array of patients' conditions, and hypertension is just general hypertension is certainly going to be more common than a diagnosis of Pheo. Acid reflux is going to be just so much more common than a diagnosis of Pheo. And so, you know, the more we raise awareness and have our patients and the community thinking about these diseases, hopefully that makes for a shorter period time to diagnosis for our patients.
And exactly as you say, you know, those things like hypertension, acid reflux, they are so much more common. That's, you know, why they call us zebras, is when you hear hoofbeats, think horses, not zebras. But if you're a zebra, it is a little difficult to get that kind of people to think of the zebras. And so that's why we're so appreciative of people like you, doctor, that are, you know, so focused on spreading the word and thinking of Pheo and everything as you know, interact with colleagues. And so moving on, I did want to bring up something that isn't a TV episode. It's a book called, this is the autobiography of Dave Stewart of the Eurythmics. And let's see if it'll let me show. It's probably backwards, but it says, "Sweet dreams are made of this." And so he has a chapter in it. And it is actually called pheochromocytoma, which I thought was really neat because he is a pheochromocytoma patient. And what was interesting about this is, so it's kind of going over, and this is where I think is super fascinating, and probably more so for you as a doctor, is some of the doctor coordination issues. So Dave was moving from the UK to the US. He didn't have a Pheo diagnosis yet, but he was having panic attacks, lots of digestive issues. So he moved to the US, and his UK doctor actually flew out to the US and spent 2 days giving his medical history, which is almost unheard of, right? That is dedication. So they said he had diverticulitis, which is apparently a thinning of the lining of the colon, if I'm not mistaken.
So there are small outpouches of the colon that can develop for many different reasons. And when there is an infection there, patients can have what's called diverticulitis. So the diverticula are the little outpouching.
Oh, okay. Thank you. Thank you for the correction. That's good to know. Well, he got the diagnosis of diverticulitis. But then his doctor in the United States, spent 90 minutes speaking with him and had him do more tests because they suspected something. And so they found a mass on his adrenal gland, and it turned out to be a Pheo. And so they put him on beta blockers right away. Now, I believe, please correct me, usually a standard practice is to put somebody on alpha blockers first and then beta
Alpha
blockers.
blockers first, absolutely.
Yeah. I remember I was on phenoxybenzamine. I had to memorize how to say that. And then they put me on atenolol as the beta blocker during my surgery preparation period. But they put him on it right away because they know, okay, this is a serious issue. You need to get this out first, because they can't deal with diverticulitis then Pheo, because they'll have a hypertensive crisis. So what was interesting is that he had both Pheo and diverticulitis surgery at the same time, which I'm not a surgeon. I don't know how that is, but that seems like a pretty rough surgery. And he said that his surgery lasted a lot longer than normal, and his recovery lasted a lot longer than normal because they had the two surgeries at the same time. So doctor, I was wondering, like, from your perspective, kind of, you know, looking at his case and how much coordination there was, kind of speaking in general terms, how important is it to have this kind of communication between two different sets of doctors?
Oh, it is so important. I mean, I can't stress that enough. You know, at a place like my medical center, just for example, we're very fortunate to have specialists in practically every field that you can imagine. And so when you have a patient with, you know, two different disease processes going on, we can readily communicate with the other specialist. I mean, that may not be the case everywhere. In terms of, you know, it's hard to speak not knowing, you know, his case in great detail, but, you know, certainly the timing of surgery, the whether or not to do two surgeries at the same time or one, that is a very, very tricky question, and it's a very, very tricky situation to be in. And so it would certainly require a lot of conversations with the entire team that's involved in that multidisciplinary approach to see what's best for that individual patient. So to answer your question, the communication and the preparation for a surgery like this would be very involved and require a lot of people to put their heads together and think on that one.
Yeah, and it was just really, you know, amazing to see, like, you know, doctors spend so much time caring for their patients. I'm sure from a doctor's perspective, you know, there's a reason why we respect doctors so much in our society, is because it's a hard job. And I think some of the interesting is some of the aspects that the doctors, when they perform surgery, must be pretty difficult too. Also, you know, of the pop culture references that we've talked about, this seemed to be the most accurate, because it was somebody who's gone through the process. And I think many Pheo patients really, you know, say how critical it is to become quasi experts, just to know, okay, like, you have to advocate for yourself in at some times. You have to pay attention to your symptoms to see, like, oh, am I experiencing anxiety? Maybe I need to contact my doctor and things like that. I know I've contacted my doctor about some aspects. Unfortunately, my blood work came back, it wasn't that issue, but, you know, just being able to show, like, you know, the writers were great, you know, for these television shows, that they brought this to the fore, that it's in people's imaginations. But now, like, seeing the contrast with somebody who really has gone through it, I thought that was very interesting. It was extremely well written book. I would, you know, highly recommend, you know, reading his chapter on pheochromocytoma and exploring more of it. It's just a really, really great read. Wanted to give
Yeah,
as
I
our
think
time.
getting that patient's perspective, whether it's from, you know, a book like that where you're reading uh, on the topic by someone who's been through it themselves, or, you know, going to meetings or being a part of an organization like Pheo where you're speaking with other people who've been through it. I think that, you know, that really just enhances the patient's experience while they're going through it themselves, no matter where you are in the process, whether it's initial diagnosis, preoperative management, or, you know, the long-term surveillance that goes with it.
Absolutely. Absolutely. And it was it's really neat to hear these patient, as you said, these patient stories, and to get these out there. And, you know, how Pheo does a lot of, you know, telling patient stories. And I think, you know, as we increase that awareness, it's I think these kinds of events like Awareness Week are just great. I did want to highlight two other things from what is popular culture. So we have the Hatfields and McCoys. and how, they're kind of synonymous with hatred and anger and feuding, fighting, things like that in American history, and how they had, was it the HTL mutation that
I
they,
think, was it VHL, I believe?
VHL, my apologies, VHL, yes. A VHL mutation. So they think that there could have been some Pheos or Paras in that family that could have contributed to some of the anxiety and fear, and that could lead to that kind of fighting. So it would be interesting to see. I mean, there's no way to know so long after it took place, but it is really interesting to see that could have been a contributing factor. Also, President Eisenhower, when he passed away, that they think that his pheochromocytoma could have impacted his timing of death, even though he did die at a fairly advanced age. And then finally wanted to give a shout out to Chad Gilbert of Newfound Glory, who has been very open and very public about his journey in metastatic pheochromocytoma and really trying to raise the awareness of the disease with people in the community, and just, using his celebrity to make sure that people are aware, that people can get better care, I think is a great thing and should definitely be applauded.
Absolutely. Well, this has been so much fun.
It has
And
been.
I hope the viewers enjoyed it, and hopefully or maybe we'll go and have a look at some of these episodes if they haven't already. And hopefully the viewers will enjoy the rest of the events in Pheo Awareness Week that we have coming up for them.
Absolutely. Well, Dr. Tanaz Vaghaiwalla, thank you so much for your time today. Really appreciate it.
Thanks for having me.